Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
Okay, so today we're just going to answer a question that we get asked a lot.
Okay.
And that is, will I hear anything during surgery? Or will I see anything during surgery?
So I definitely hope not to the second one, and the first one's up for debate. So what do you tell people?
Okay. We've actually made a video about the anesthetics. We use spinal anesthetics, where we kind of talked about this a bit. But generally, if you don't want to hear anything and you want to be sedated and asleep, you can tell your anesthetist and they will give you medication that will make you like sleep right through the whole thing. So you probably won't hear anything.
Yes, I want to be sedated. I think that's the song.
Yeah, exactly. The Ramones.
Right. So yeah, when you get your freezing in your legs, usually that's done in a separate room these days. You're brought into the operating room. We get everything positioned, and then the anesthetist gives you medication that will make you sleepy. So sometimes that means you're just groggy. Sometimes it means that you're totally asleep and actually snoring quite loudly sometimes.
So we hear it.
Yeah. And then every now and then you'll actually wake up intermittently, and then you'll say, and then the anesthetist will give you more medication.
Yeah. Then the things you don't want to hear is one of us saying, oh man, that wasn't supposed to happen. Or I've never seen this before.
Yeah, you don't want to be the interesting case.
That could be disconcerting. We don't say that often.
No, not very often. And even if you do wake up, often they'll give you medication that causes something called amnesia or something called retrograde amnesia, where you'll even forget what happened before, just so that it's a more pleasurable experience.
What was that?
Yeah.
No, I'm just kidding.
Yeah, so it's a safe class of drugs that is a light sedative but also makes you forget. So that routinely when people wake up after these operations, they say, is it already done? Or
people often can't believe that it's over. Like, did you do anything? I didn't even know if you did anything.
And even the people that are talking and snoring and doing stuff don't remember what happened.
Yeah.
What about the seeing part?
Seeing?
Yeah, like they say, am I going to see anything? Or I want to see the operation.
Not so much with hip and knee replacement. There's a drape there, so you can't really see anything.
Yeah.
But when we're doing arthroscopy and the interesting stuff is on the screen, I have had patients say, I want to be awake enough so I can see it and watch the scope. That's not common because usually we do the scopes with a general anesthetic because it's such a quick procedure. So it's a light general anesthetic. You don't really get that spinal for the arthroscopy, but some people do wish to see it, or if for some reason you can't have a general anesthetic and you have to have it under a local anesthetic, some people do like to watch the scope and see inside their knee. Most people don't.
I would agree, and I discourage that because when I'm operating, to be honest, I don't want to necessarily be talking to the patient who's having the operation. I'd rather just be focusing on the procedure.
You want to chat along the way?
Yeah, no. Because even sometimes when the drape's up, you're like, hey, how's it going? I'm like, hey, I'm just trying to work here.
I'm busy.
I don't come to your work and heckle you.
Yeah.
So the good news is you will hear and see as little as you want to, and typically you'll wake up and you'll head off to recovery and you'll barely even know that it happened.
Yeah, we want you to sleep too because we don't like hecklers.
That's right. That's right. So, hey, if you like this video, please like it, subscribe to our channel, leave a comment down below.
And remember, you are in charge of your own health.
We'll see you next time.
Hey, before you swipe away, thank you so much for watching our videos.
Yeah, for sure.
We know they can drag on, get a little bit long and boring sometimes, but it's all information that we're trying to pass along.
And so if you want to watch some of the other videos, swipe it up here.
Where?
Up here.
Okay. Let me do it for you.
And remember to subscribe down below.
Let me do that for you.